talk about your pain and your symptoms first.
So it's been going on for about 20 years, I'd say, maybe a little longer. I have pain that'll be in mid to lower back. I have a, like this sharp, sometimes dull. It's a mixture of a pain or like a sensation that'll go down the outer thigh or like over the top of my left leg.
That is L2, 3, and L4 nerve root that goes to those areas. Please go out.
It hasn't happened since I started physical therapy, which I think maybe it's coincidental, but I used to have this sharp pain that would go into like my groin, and it felt like someone was kicking me.
That is
like,
L1 nerve root.
Yeah.
Good.
It
Good
just felt like someone
description.
was kicking me in like the nuts or testicles, just like the left side only. It was never the right.
Okay.
And it was a brutal pain.
Yeah.
And it would
It
happen
can be up to
after
10.
pain for that. That was a 10.
10, okay.
Because it just felt like someone was kicking you with like steel toe boots in your groin. And it would happen after like 10 minutes of walking. And I can walk for like over an hour now. And
so leg pain is getting better, but you still have back pain.
Yeah.
Okay. You told me as well you had some of the kind of this problem and some the history of spine problem in your family. Can you tell me about that?
Yeah, my mom has, with her, when she was like 15, 16, she had some back pain and they brought her in to see a doctor or something. They said that she had a bone structure of like a 50-year-old woman or something when she was like 15, 16, 17. She's had her spine fused from low back to, I don't know if it's her full spine, it could be, but they said the same thing you were saying before, is that she had a cage that she had put in.
She had a spinal fusion,
And my uncle is fused from his neck down to his like tailbone, basically.
So scoliosis. I think we are dealing with scoliosis, and that's what you have as well here. So you have spinal scoliosis here, and most of your symptom L1, 2 send the nerve to the groin. These two send the nerves to the front, and the nerve that comes out about here or here, both of them can go to the side of the thigh. So you have the symptoms of L1 to 4 with the scoliosis that is 35-degree there. Your mother got a surgery, and you told me, where did your mother get the surgery and when?
I think hers was down at the Mayo Clinic.
When?
It was fused, I would say somewhere between like 2005, 2007, maybe 8.
Or in an open surgery, that the way we do the surgery hasn't changed much. Our technology and so on are better now, but you told me you weren't happy with her recovery. What can you describe to me what happened or how it was?
Once she came back, so I believe she was at the hospital for 1 or 2 weeks. We had to get a hospital bed that we put in our living room, and I believe she was in there for almost 12 months.
12 months, yeah.
So we would have to go and slowly lift her and put a bedpan underneath her, just so she could use the bathroom for quite a few months. And then if she ever got up, she had to put this, it was a really hard plastic.
Turtle shell.
Yeah. It almost looked like I don't know, like a corset or something.
Yeah,
it was just like really, I guess, restricting, which is what it's supposed to do.
Yeah.
But I don't want to be in a bed for 12 months.
Yeah. And there are 2 different kind of thoughts in correcting your problem, which is a scoliosis, a serious problem. One is a fuse from chest down and fuse everything and correct everything. Look at your bone is growing in some places here. Or to correct that completely, we have to break all these bones and make the picture look pretty.
Right.
But we talked about that your spine took about 35 years to get there. And if sometimes when we try to bend it what we consider the correct way, that is not natural for you. That stretches the nerves and the vessels too much. We know that picture will look good if you do that, but that's a 12-hour surgery. That's a year or 2 years recovery. But sometimes people wake up with significant deficit because this is not the natural for your spine to go straight up and down. My take on that and some of my colleagues is that we be gentle with nature. We just correct what your body let us correct and fuse it in that position, and let your body take care of that as well. Doing the smallest possible surgery. In your case, I'm not recommending doing a chest down to pelvis fusion, but only 3 levels. That's a surgery we can do in 1.5 hours in a surgery center and send you out same day or next day latest. And we have a result that shows, if we break a big surgery in smaller surgeries, we can significantly improve the outcome, because your body is not twice as hard to do a 2 surgery in one. It's 4 times sometimes harder. Your body has to spend much more resources. Now, having said that, we talked about as well your symptoms. Most of your symptoms correspond to those levels and as well the bending. Most of the bending is in the same levels.
L1 through L4.
L1 to L4.
Yep.
Now, but you as well, as you told me, you have seen the recovery after the alternative. What the alternatives is, or like opening it up and doing the open old-fashioned surgery. Now, what are your thoughts on the staging this procedure after what we talked about?
What do you mean staging?
Staging meaning that instead of doing it, if you need to do a surgery later on,
like
you do the smaller surgery.
You do
and
one, then you might have to do another one later on.
Yeah.
I love that idea.
Yeah.
Just because, one, I think that L1 through L4 area will help a lot, because again, when I lay flat, my spine kind of does this where it will twist and then it goes out.
Yeah.
But if I lay flat, it actually will go straight, like not completely straight, but then it'll pull back.
It is actually very interesting what you say. We try before the surgery, put a brace and correct this as much as we can. And look at, you're absolutely right. Look at, this is what we call spinal process. It should go straight down. It doesn't. You do have a twist, and it's actually interesting that you feel that twist. And many times when I put the patient on the surgical bed, actually many of that problem correct itself. All I have to do is making sure that it stays that way. And that is again another, kind of thinking from us, that let your body deal with most of the problem and you just make sure it stays that way, rather than breaking all the bones. And we have names for that. We call it osteotomies, doing 5 different osteotomies, breaking the bones to make the picture look great. So it's interesting that you feel that twist in your back.
Yeah, when you deal with it
for so long, yeah.
I'm 35 now, and I've had this since, scoliosis, I'm assuming is around like early teens, mid-teens. Because I know when I would say 13, 14, they did like the old test where you kind of bend over in front of the nurse, and you have scoliosis or you don't. And it's been there since then.
Now, what about your uncle? You said he got as well as scoliosis, big surgery.
He told me, because I used to talk to him about this a lot, because when he sits, his body is completely straight. Like he can't move it because it's fused all the way down.
Yeah.
He said he wishes he never had it. And some people, I don't know who, this is like anecdotal because it's just the people that I know. They're like, he is in pain a lot, so he's like constantly on painkillers or painkillers, and I don't want to live like that.
Yeah, and unfortunately, another problem is that when we put the threshold that some of our surgeon, good surgeon, they say either fix everything or don't fix anything at all. As well, not only that, then we produce what you just described, bad results, but as well we put the threshold so high. You're a young person. I think every scoliosis surgeon would still give you the option of open surgery. But if the options are only not doing surgery or doing chest down fusion, lots of elderly, especially elderly, that's too much for them. So we condemn them to live in pain, become narcotic addict, and we literally keep them and we refuse to help them at all with the surgical option. Whereas if we break it, we are bringing the risk so far down that we still can give that option to many more patients. So that concept of fixing the picture with the surgery chest down is not only reduce the risk, but it will breaking that surgery in smaller pieces will give the option to many patients that otherwise they wouldn't even have that option. So, and as well in your own family, you have seen the results of that. Yeah.
Yeah, I don't want to experience that at all.
Yeah. Any other question for me?
No, I agree with the L1 through L4 thing again, because
here it is.
I'm not a doctor, but if I can feel that my spine will kind of it'll like sort of correct the rotation and straighten out mostly.
Yeah.
Whenever I lay down and I get up and it goes back, because whenever I get out of bed in the morning, my body is like this.
Yeah.
And then over the next like 10-20 minutes, I'll straighten out again.
Yeah.
But that's just because my spine is twisting and it's moving.
Yeah. So the numbers that we have for this kind of surgery is actually, most of my colleagues don't believe that we can do that. We do this surgery in 1.5 hours to 2 hours max. We do it in your age group many times in a surgery center. Even with this scoliosis, that is unheard of. Our usual blood loss is for 3 level is about 100 to 200 cc, which is about half a cup of coffee. And 90% of our patients go home within 24 hours. Our risk of infection is 0.2. Open surgery risk of infection is 3 to 5% without scoliosis. For scoliosis surgery, that is significantly higher. And as well, in your age group for this kind of surgery, I've never needed to transfuse anybody because our blood loss is so little.
Yeah, I'm not worried about it at all.
Well, that is the numbers.
I know there's risks, but
the numbers are on our side.
Right.
Very significantly. Okay. Well, thank you for the interview. I appreciate that. Okay.
Yeah, no problem.